My name's Kelly Hayward Walsh. I work for OU Health, the health system that's part of the University of Oklahoma Health Sciences Center and OU Health, the hospitals. And so my role with the enterprise is Director of Community Partnerships. And like I said, I'm just really excited to be able to be a part of this panel and help moderate with these great physicians that we have. This is such an important topic, COVID-19 vaccine in pregnancy. And then also we're really going to touch on both in pregnancy and also with fertility questions that you might have. So maybe you're someone that has never had a child, but you're thinking about having one. Maybe you're pregnant now. Maybe you've had children and you're still thinking about having more children. So that we're going to really talk about all of the misconceptions, questions, myths out there about the vaccine itself with how it relates to pregnancy and fertility. We're not going to do a formal presentation. When I met with the physicians, we talked through what we thought would be best, and we really just thought having a true conversation with you all. I'm going to start out by introducing our panelists, and then we're going to go into some Q&A that specifically talks about each of their areas of expertise. And then we're also going to go into some Q&A. We did receive some questions via Facebook and Instagram, and we'll get to those. And then we will close out this session with taking the questions from the chat and from our Q&A function on the webinar. So if any of you have questions right now, we may get to them, but you might as well go ahead and start putting those in the chat and the Q&A, and we'll make sure to try to get to every question that we get through in the hour. But without further ado, I'd love to introduce our panelists. I'm going to start out by introducing Dr. Kathryn Kramer. Kathryn Kramer is an obstetrician-gynecologist at OU Health. As an OBGYN, Dr. Kramer provides care for women in all stages of their life, including routine well women exams, prenatal care, and childbirth, as well as menopause. Dr. Kramer is passionate about taking care of women and empowering women to prioritize their care. She's completed a residency in obstetrics and gynecology at the University of Oklahoma College of Medicine in Oklahoma City after finishing medical school at the University of Texas Health Sciences Center in Houston. Welcome, Dr. Kramer. Thanks for being here with us tonight.
Thanks for having me.
Our next panelist is Dr. Stefanie Bryant. Stefanie is a maternal-fetal medicine specialist with OU Health Physicians. Dr. Bryant is dedicated to providing exceptional medical care and helping her patients make informed decisions throughout their pregnancy. Dr. Bryant earned her medical degree from the University of Texas Health Science Center and completed her residency and fellowship training at the University of Texas Southwestern Medical Center. Welcome, Dr. Bryant. Thanks for coming tonight.
Happy to be here.
Two Texas girls.
Proud of it too.
Yeah. Dr. Blake Evans is a reproductive endocrinology and infertility specialist with OU Health. Dr. Evans provides compassionate care for women who experience reproductive or infertility conditions. A native Oklahoman, Dr. Evans earned his medical degree as well as completed obstetrics and gynecology residency at Oklahoma State University Center for Health Sciences. He then completed his fellowship training in reproductive endocrinology and infertility at the National Institutes of Health. Welcome, Dr. Evans.
Thank you so much. Happy to be here.
So this topic has been something a lot of women and families have been talking about for a while now, but it really is timely. Dr. Kramer mentioned how timely this is because the CDC just announced some new information today around this. And before we dive into kind of the three questions I was going to pin for each physician, I'd love for her to kind of talk about what that was today to get us started.
Sure. Today, the CDC announced an urgent practice advisory, basically to encourage all women, those who are pregnant and those who are considering pregnancy, to get vaccinated. They announced data that said over 125,000 pregnant women have tested positive for COVID since COVID first emerged about a year and a half ago. There's been 161 deaths in the United States over that time period. And unfortunately, just 22 deaths just in the month of August last month, which is the highest recorded. Furthermore, they said that 97% of people hospitalized for COVID were unvaccinated, which just goes to show the importance of the vaccine. So that's just some of the basics, but it just seemed very timely that they announced that this afternoon, and then we're here this evening. So
yeah, and Dr. Evans, you actually a few days ago, maybe yesterday, the day before, sent an email as well when we were discussing tonight about another CDC that research thing that came out that was just reassuring the data of safety and efficacy with no increased background of risk miscarriages and those types of things. Do you want to talk a little bit about that?
Yeah, sure. So they have interim meetings intermittently, and basically what they're doing is assessing what's called a V-Safe or Vaccine Safe Registry. So when you get the vaccine, you have the option to register, and you're sent intermittently questions about symptomatology. Are you pregnant? Where are you at in your pregnancy? And they will follow after pregnancy as well. So one of the largest publications we have from this was in April in the New England Journal of Medicine, and over 35,000 women were part of this study in showing that there was no overall increased risk of things such as miscarriage or congenital anomalies or any other background risk of women who have received these vaccines. And so basically this interim analysis was about a week ago, I think it was, just continuing to solidify this information. There's now been over, I think is 130,000 at least. The numbers, you can check it on the V-Safe website or on the CDC website, but well over 100,000 women at this point have received a vaccine who are all at different stages in their pregnancies. And we're still continuing to find reassuring data that there is no, in fact, increased baseline risk.
That's wonderful. I know we'll get to it a little later in our discussion just around what you all have been seeing with pregnancies and the pregnancies where the women decided to get vaccinated versus not. And so we'll talk a little bit about that. But I'd love to just start off our session, Dr. Evans, with you explaining what is the vaccine, what's in it, how it's made, how in general terms for our audience, just talk a little bit about the vaccine itself.
Yeah, happy to. So think of the vaccine, and largely the studies that I'm going to be citing, at least from the fertility aspect, are largely done with the mRNA vaccines. So Pfizer and Moderna, those are the ones that were released first. And so at least in my specialty, we have a larger amount of data with regards to that. But particularly when we're talking about the mRNA vaccines, this is what you can think of as like a code. In our body, we have DNA that's converted to mRNA and eventually turns into proteins. And so the vaccine has mRNA, basically, like I said, a code for the surface protein that's on COVID. And so, or this is also known as the SARS-CoV-2 surface glycoprotein. So when we introduce this mRNA code into our body that's inside of lipid particles, essentially in this vaccine that ultimately will break down, our body mounts an immune response to it. It sees this code of mRNA. It does not in any way change our own DNA whatsoever, which is something I very commonly hear that it does do that, but it does not change our DNA. And then our body starts to mount a response to form antibodies to this mRNA code. And so we start to actually form the spike protein that's on the COVID, the actual vaccine, or excuse me, the virus itself. And now the spike protein is what COVID ultimately uses to get inside of our cells and make us sick. So eventually when we have this code, we're making antibodies. Our body is making a natural response to this newly formed protein. And so we ultimately have just a huge army of antibodies that will attack this spike protein. So in the event that we are exposed to COVID, that we already have an immune response for it. And so, and I wanted to just kind of put in what I feel is a really important side plug into this while we're on this topic too, with regards to infertility, because there was a blog that had posted a very baseless claim with no evidence whatsoever. This was back in about, like right when the vaccines are starting to come out, so around December, that the vaccine itself leads to female sterility, which is in fact entirely baseless. There was no evidence whatsoever at the time. And so kind of in tandem of what I was saying about making antibodies against the spike protein, they had said that the placenta has a protein called syncytin-1, and this is an important protein responsible for the placenta adhering to the uterine wall and developing. But the claim was that the vaccine actually has spike protein inside of it, and it actually is going to be, the spike protein is very similar to syncytin-1 in the placenta. And so therefore they had theorized and just exploded on the internet and created this huge ruckus that if you get the vaccine, you're going to be attacking the human placenta and you will never be able to be pregnant. You'll be sterile. Completely baseless, completely not true. So I just wanted to put a side plug in while I'm on this topic, that I had the opportunity of publishing a paper in January with 8 other reproductive endocrinology and infertility physicians from across the country. And we actually literally looked at the amino acid sequence of the spike protein and syncytin-1, and they are not homologous in any way. So they don't, they share a couple of amino acids, but overall the structure is not significantly homologous. And so biologically, it's not plausible for that to even occur. And so I just wanted to put that plug in there too while we're on that topic.
Yeah, that's really important information. I think a lot of people, that is what they've read and have seen and have kind of latched onto, not not having the information to kind of rebuke that. So that's great to know. And I'm so glad you shared that. Okay, we're going to move on to Dr. Bryant. Why is the vaccination during pregnancy recommended? And are there more complications of COVID in pregnancy? This is going to talk a little bit about what I referenced a little bit ago, what you're seeing.
Yeah, so I think it's very important to know that, and Dr. Kramer, I think will speak a little bit to this as well. There are more complications for pregnant women who do get COVID, especially when compared to non-pregnant women or pregnant women who do not get COVID. So yes, as a general rule, the vaccine is recommended, and that was a very large part of what the CDC came out with today in the urgent practice advisory, was basically a call for physicians to really amp up the conversation that we're having with patients to recommend the vaccine. Because like Dr. Kramer said, 97% of those cases, it's kind of mirrors the general population as well. The majority of the cases of hospitalized patients are unvaccinated. Speaking to the risk of, pregnancy and COVID, we've seen anything from fairly asymptomatic patients in clinic all the way to, can y'all hear that? They're testing the fire alarms apparently in the building.
Naturally.
Y'all hear it?
Vaguely. It's just very soft.
Okay.
No, it's not, it doesn't, yeah. It's probably bothering you more than it is us.
Okay. So there's actually, compared to non-pregnant women that are kind of matched in some of the studies, you have a 3 times higher risk of going to the ICU if you're pregnant. 2.4 times getting the risk of being on ECMO, which is heart-lung bypass. So that's kind of the next step. If they cannot keep your oxygen up and cannot keep you alive just on the ventilator with medication, sometimes they have to go to heart-lung bypass. And actually a 1.7 times increased risk of death over the non-pregnant kind of age match and risk matched patients that get COVID. So we know, and there's almost a 3 times increased risk of needing mechanical ventilation, needing intubation, a tube down your throat to help you breathe. And so there are definitely increased risks to getting COVID while you're pregnant. In addition, COVID during pregnancy can also lead to increased risk for preterm birth. The babies go to the NICU more often, and increased risk of neonatal death because of the prematurity issues and things like that are going on, not necessarily because of COVID infection, but because of the risk of prematurity. There have been stillbirths reported associated with active COVID infection, and growth restrictions also been associated with getting COVID during pregnancy. So if you're getting vaccinated, clearly that it protects you from the virus. It also protects you from getting severe disease during pregnancy. So it helps prevent a lot of those complications and decreasing your risk for those potentially very serious complications during pregnancy.
Well, pregnancy, that time in a woman's life is scary enough, there's a lot that you're facing. There's a lot of things, and not to really joke, laughing aside, it is serious because there's women, if you've been pregnant, you think about even things like, oh, I can't eat lunch meat. I can't eat sushi. We're constantly, when we're either trying to get pregnant or pregnant, making sure we're doing everything the way we're supposed to. and not only for our safety as women, but for the child. And so it really leads into the next question for Dr. Kramer is, are these vaccines safe? I mean, what do you say as a physician? What are you telling your patients the reason that they should definitely get this vaccine for COVID-19?
Well, for starters, I'm very confident these vaccines are safe. As Dr. Evans mentioned, initially when the vaccine came out, we were basing a lot of our guidance and recommendations based on how the vaccines work and the fact that we didn't think that it should have any impact on the placenta or on babies. And so that's when I was having those conversations that I'm pretty confident, but it's been 9 months now since the vaccines have been out, we've gathered more and more data. So like Dr. Evans mentioned, in that V-Safe registry, 35,000 participants, this was in the New England Journal of Medicine article that came out in April, had registered, were identifying as pregnant. And then they further drilled that down and they looked at 4,000 women as a part of the V-Safe pregnancy registry. And these women were kind enough to kind of volunteer their information, but they touched base with them quite often to see how they were doing in pregnancy, any specific side effects. And so in that data, they looked at different things. They looked at one, increased risk of pregnancy loss. So is the vaccine associated with pregnancy loss, whether it's a first trimester miscarriage or a stillbirth? What they found was that rate was about 12.6%, which at first when you hear that, you think that sounds high. However, at baseline, a woman's risk of pregnancy loss is anywhere, if you look at the studies, between 10 and 26%. So it's right there and compared with baseline. They also looked at risk of preterm birth, so delivering sometime before your due date, more than 3 weeks before your due date. With that, they found a rate of 9.4%. At baseline, looking at previous studies not affiliated with the vaccine, that baseline rate is between 8 to 15%. So it's right there compared with baseline. One of the other things that people are really concerned about, though, what about congenital anomalies? So is my baby going to be born with a heart defect, brain problem, something of that nature? In general, and Dr. Bryant can certainly talk more to this because I know she counsels a lot of women with ultrasound abnormalities, but the baseline rate for congenital anomalies is about 3%. In this registry data, it was about 2.2%. So less than the baseline, but nothing to suggest that there's a correlation or a causation from the vaccine. So although those are not directly comparable, that data was really reassuring. The other question I hear, and I even saw it in the chat, is how do we know the long-term effects of the vaccine and that this isn't going to cause problems down the line? I think there's kind of the biggest thing that I'd say is going back to what Dr. Evans talked to about how the vaccine works, that vaccine introduces this code to make that spike protein so your body can recognize that spike protein and make antibodies. But that mRNA that vaccine makes is destroyed within a couple days. And so really when we look at long-term risks of the vaccine, we don't see any because of how these vaccines work. And so this is somewhat cavalier, but I've seen it quite a bit of places. At this point, the only long-term effect of the vaccine that we know is survival. You are highly unlikely to have complications from COVID or die. And so that's the kind of thing that I reassure my patients.
Well, and I love how you talk about the long-term effects, because I've had many conversations even with family members where, it's not from a medical terminology standpoint, but just the understanding of the long-term effects of COVID are much more, scary that we don't know versus getting this vaccine and keeping yourself safe and your baby safe if you're pregnant. So
yeah. I hear people say, well, COVID has a 99% survival rate. That's true, but if you say that 1% don't survive, that's 3.3 million United States citizens, which is a significant population. It's somebody that highly likely. And so thinking of that, and then that's not taking into account when we're kind of circling back to pregnancy, that survival or the risk of getting sicker and survival rates much lower in pregnancy. So just something to think about.
Yeah.
Can I piggyback? Can I piggyback on something that Dr. Kramer said? Just with regard to vaccine safety, the vaccine itself is degraded within several days and completely gone within a couple of weeks. Those antibodies that we make to help keep us from getting infected, those are what stay around and help us to keep getting from getting infected. Nothing of the vaccine actually crosses the placenta. So the vaccine itself does not reach the baby. But the antibodies that mom makes to help protect her against COVID do cross the placenta. And those do help protect the baby. And the maternal antibodies last in the baby just in general for about 3 to 6 months of life. And it's kind of the same reason that we get the Tdap or the flu shot.
Right.
Mom makes antibodies against pertussis and against the flu. And those antibodies cross the placenta and help protect baby until baby can get some of their own vaccines. And so that's also another advantage and safety measure that we think of with the vaccine, is that the vaccine itself does not cross the placenta, but the antibodies that are the helpful part and the results of the vaccine do cross the placenta and are helpful to baby.
I literally just had this conversation. We hosted a doc talk with Dr. Donna Tayungu, who's one of our pediatric physicians, infectious disease physicians. And we did a doc talk like this on kids and vaccines. And we were talking about the rollout of the 5 to 12 age group and then the under 5, and how the under 5 is a ways away. And I had thought to myself at the time, and then I've been telling people, I had a baby February 2020. Right before all of this happened. And I'm like, man, I wish I could have gotten the vaccine for my baby who's now 19 months, because I would have so much more like ease of mind that those antibodies were passed to her. And now instead I'm waiting until she's eligible to get the vaccine. So it's great that you point out that that is not just for the safety of yourself, but it will protect your child too.
And I will say, personally, I had a baby in November of last year, 2020, and he came early. So I didn't have a chance to get the vaccine while I was still pregnant, although I would have, but I did get it in December, January, when he was still very early and I was nursing. And part of the reason I did it was not only because I'm a healthcare worker and was going to be coming back to, the hospital, with the antibodies that could potentially be passed along, via my breast milk to him. And so that's how confident I was, in the vaccine and in lactation and things like that. There's also no concerns. And we talk a lot about pregnancy, but for the lactation, it's the kind of a similar, similar concept. There's not any danger that we know of. And there's no mechanism by which it would hurt the baby. So it's also recommended in lactation as well.
Great.
Kind of to follow up on that, I think it's really cool to talk about how it's passed on via lactation. So essentially it's through passive immunity, which is a really nerdy, and granted, I will say I was not an immunology fan in medical school, but basically the mammary glands, your breast tissue, sends out signals that attracts the cells that make your antibodies. So you have extra antibodies in your breast tissue, and the milk ducts are able to grab them, package them up, and pass them along and through the baby milk. While it's not the same as antibodies being passed through the placenta, through the cord blood where you have it in your system, what it does though is that when baby drinks this milk, it coats your nose, it coats the throat, it coats your digestive system. And so we think that that offers some degree of protection. It might help fight off infections before they start. And we're still learning kind of to what extent, how long does the antibodies last in a mom's breast milk after they've been vaccinated, and to what degree does that show some protection? But we are seeing data of showing babies that have been born to moms that have been vaccinated, that are breastfeeding, that you see evidence of antibodies that they have. So they're definitely getting some protection. We're still waiting to figure out what measure, but it's kind of exciting and reassuring all at once.
That's amazing. I'd like to pivot. Oh, sorry, Dr. Bryant, did you have something?
I was a part of several studies when this was all happening and, being vaccinated while I was producing breast milk. And there were many studies that showed there were antibodies detectable in the breast milk. And there were no baby effects, no neonatal effects from the vaccine. There was no increased fussiness. There was no decrease in supply. There were no other effects that could be contributed to the vaccine itself.
Wonderful. That's amazing that that you were part of a study above and beyond for sure. Well, I'd love to pivot.
Donating that precious breast milk.
Oh my gosh, seriously. Well, let's pivot and let's talk about, Dr. Evans, I'd love to talk a little bit about fertility and what you're seeing. You know, as I opened, not knowing our audience completely on this call, but assuming that we have a lot of folks that are either pregnant thinking about getting the vaccine or thinking about getting pregnant. So fertility really comes into mind around a lot of folks' concerns. So talk a little bit about the vaccine itself, what you're seeing and how it's relating to both female and male fertility concerns.
Yeah, great question. So initially when the vaccine came out, a lot of what we were saying was based off of biologic plausibility. So, okay, this is how the vaccine works. Presumably it's very safe. We know the risk of COVID and we know the risk if you're pregnant with COVID, but the data had yet to formulate on fertility, on pregnancy. And over time, we're starting to get more and more reassurance and just more of solidifying what we've known and what we've been talking about all along. But with regards to fertility specifically, because my patients that I have are particularly in a vulnerable state. They've been trying to start their family for years and years and years. And the last thing they want to do is something to compromise even more their chances of pregnancy when they're already having fertility issues and struggling with fertility. And believe me when I say, I would never tell you to do anything that would compromise your chances of successful pregnancy and accomplishing your goals of starting a family. So we go off of, just as physicians in general, we go off of the evidence, we go off of what the science tells us, not politics, not what some blog tells us, not what someone's cousin's friend who is pregnant, we go off of the data. So we do have studies now that show that it does not impact fertility. As I mentioned, that paper I was a part of in January, that was a lot of discussing biologic plausibility and kind of debunking the myth that was saying that females would be sterile. But now there are studies actually in the past few months, one of which was in fertility and sterility, where they looked at patients who are either vaccinated with antibodies, had a natural infection, or had just COVID without being vaccinated and had antibodies, or someone who had neither. And then they did embryo transfers on all these patients, and they of course controlled them for BMI, their age, embryo quality, things such as that. And the pregnancy rates were the same with all groups. And so these are ongoing pregnancies as well. And so there was no difference in pregnancy rates. There was no increase in miscarriage rates. They were all the same. And then similarly on the male aspect too, we have studies that one was in the Journal of American Medical Association recently, in which they looked at, this was a smaller study, but still very reassuring data. There's about 45 men who had volunteered to give semen analyses before the vaccine, as well as about 70 days after the vaccine. So basically most of the process of spermatogenesis. And there also was no change in their sperm parameters or the semen analysis parameters whatsoever from before the vaccine and afterwards. And these are just a couple of examples of some of the data that we're having, but we're also not seeing any changes in things like our success rates within our clinic, pregnancy rates within our clinic, miscarriage rates, and not just within our clinic, but as these studies we keep alluding to, the studies that Dr. Kramer had mentioned earlier, miscarriage rate has been very similar to baseline as well. So the evidence is starting to mount, and it's becoming more and more clear that that there's no effect on fertility, both male and female. But one thing's for certain, we know the very real risk of COVID when you are pregnant, as opposed to the female counterparts who are not pregnant with COVID. So,
Dr. Evans, correct me if I'm wrong. There is a little data also to support that COVID infection may actually impact male fertility. Not great evidence, is that correct? But some suggestions of that?
Yeah, there's some studies, particularly so at University of Miami, there are looking at more and more men who have had COVID are reporting issues with erectile dysfunction. That's one of the most prevalent one as of right now. But once again, we continue to learn more and more as time goes on, but that's, as of right now, that's one that keeps coming up, and there's limited data on that.
It goes back to the benefits of the vaccine far outweigh the risks of a COVID infection.
Mhm.
Exactly right. That's what I keep thinking about too, for sure.
Yeah.
Well, let's go back to Dr. Kramer. I want to talk a little bit about how the COVID vaccine compares to the flu vaccine. I know it's two totally different viruses, two totally different vaccines, but as pregnant women have been accustomed to, we always get, the flu vaccine while we're pregnant. So talk a little bit about the similarities and maybe even differences around both of those, especially thinking through if someone's on the call or watching this afterwards and they've been pregnant before and they've, confidently gotten the flu shot, how they should feel that that's the same and should confidently get this vaccine as well.
Sure. In regards to the mechanism of action, they are slightly different. The flu shot is not a mRNA vaccine or a viral vector vaccine like the COVID vaccines. That being said, the other big difference is the flu shot usually is a one vaccine series. The two mRNA vaccines, the Pfizer and the Moderna, are both two shot series. So Pfizer being 3 weeks, Moderna being 4 weeks. And so that is one of the differences as well. When it comes to side effects, most common side effects not being complications, mind you, but side effects most commonly are soreness at vaccination site, which is common for both flu and the COVID vaccine, as well as some signs of some women can report fevers, chills. That tends to be more common with the COVID vaccine than flu, but I will certainly tell you, I have a good number of patients when I recommend the flu saying, well, it got me sick last time. I was like, that's not the sickness, that's your body fighting it to be ready. So you certainly can see that with the flu vaccine as well. So in regards, those are kind of the similarities. They both have also the potential same benefits. So I talk to moms about the flu vaccines, one, to protect themselves, that we certainly see that flu vaccine protects pregnant women. Flu is much more dangerous for pregnancy, much like COVID. We see a 10 times increased risk of hospitalization in pregnant women with the flu. So they have similar protective effects. I talk to moms about flu vaccine. We think that those antibodies are passed on to baby. Baby is born with that protection until they're old enough to get their shots. Same goes with COVID. So there are a lot of similarities. The other thing I'll say about the flu vaccine is last year was somewhat of an anomalous year in that the flu wasn't very prevalent. We think a lot of it had to do with people kind of still under lockdown measures and mask wearing. But there's some concern, much like many have heard, that the RSV season for kids has been really bad recently. That there's concerns that flu could be bad this year too. So I'd highly encourage any moms or women considering being pregnant getting vaccinated for the flu. And you can get them at the same time. That's the other big plug, is that you can get your flu shot in one arm, your vaccine in the other one.
Awesome. So, Dr. Bryant, I'm going to ask you this, and Dr. Kramer and Evans chime in as well, but one of the questions that we had found and are getting are in regards to being pregnant and receiving the third dose, and how someone makes that decision to do that or not. And really it's a question for all of you, but I'll start with Dr. Bryant.
Yeah, so that's a great question. The bottom line is yes. If you meet the other criteria, you've been 6 months, all of that. Basically, the CDC recommends anyone between 18 and 45 years of age that got the vaccine more than 6 months ago and has an underlying health condition or is a healthcare worker to get the booster dose. And it's only approved for Pfizer so far, FDA approved, I should say. And pregnancy counts as a high risk underlying medical condition. And so we definitely recommend getting the booster if you meet the other criteria. It's been only 6 months.
Great.
The other thing I'll piggyback on to Dr. Bryant is that while it's only FDA approved for Pfizer right now, it's not that it's not approved for Moderna or Johnson & Johnson. It's just that the Pfizer was the first vaccine that was debuted, has the earliest research numbers. So they were the first company to present their more updated research numbers. I expect that in the next month or so, we're going to see data from Moderna, and they're going to release those similar recommendations, and then likely Johnson & Johnson down the line too.
And it's similar to the vaccines for vaccine approval and vaccine studies for the children as well. Those are coming from Pfizer first, just because they have more of the data, and Moderna will be quickly behind.
Yeah.
Right. Well, and I've heard that the Moderna, the efficacy is starting to show that it does last even a little bit longer. And so is that a little bit of the reasoning behind it, or is it strictly just where they were in the clinical trials ahead of Moderna?
I suspect it's where they were in the clinical trials.
Yeah.
There is some data that Moderna may have a little bit longer efficacy. I can't quote the exact numbers, but when you look at it practically, even people say, well, I don't want the Johnson & Johnson, it's not effective. Practically, those numbers are actually not that different when you look at a grand scheme of things. And so ultimately, I think all three vaccines are considered incredibly effective and really successful vaccines. And if you think of it that way, preventing that severe illness or death, which is ultimately the biggest goal of a vaccine.
Right, exactly.
And
Well, I'm going to, oh, sorry, Dr. Evans, go right ahead.
I was just going to say one thing in light of the booster. Although, we don't have statements per se yet from all the women's health societies like American Society of Reproductive Medicine, American College of OBGYN, Society of Maternal-Fetal Medicine. All of those societies do strongly recommend getting the vaccine for women who are trying to get pregnant, who are pregnant or breastfeeding. So if we're trying what the concept of the booster is to get back the immunity that you are waning on now, then I suspect that they will strongly support the boosters eventually, but we're probably just waiting for more data. But I can't imagine that they would say, no, don't get the booster. It's no longer safe anymore, because we're trying to get back those antibody responses that we initially had. So
the most recent SNFM vaccine update, the provider considerations, does address the booster and does recommend. I don't know about ACOG and ASRM. The SNFM did as of just a few days ago. Actually updated, I think on the 24th or 25th. So they have come out and said it. But again, like Dr. Evans said, this is not a safety issue. It's, how,
Right.
The efficacy of it.
Right. So that's the end of the Q&A that we had kind of come up with as a group. And I'd like to move into the Q&A that the audience submitted prior to us starting tonight. One of them we actually already answered. Does the vaccine cross the placenta? So Dr. Bryant had addressed that earlier, that it does not, just the antibodies cross the placenta. The other question we got, and I think this is more towards Dr. Kramer, why did I have a 9-day period after my second dose of Pfizer, which is very unusual for me? Are there any side effects around the vaccine and having longer menstrual cycles?
Yeah, sure. So there are certainly what we call anecdotal. So it hasn't been proven in studies, but you certainly hear reports much like this patient or this person's question of having vaccines impacting periods. That being said, they're known to be temporary effects and still do not impact fertility, much like Dr. Evans said. People reasonably make the assumption, well, obviously fertility is related to your periods, so could there be an issue? We don't think that's the case. Furthermore, another thing to think about is a recent study, nearly 20% of women who had COVID-19 experienced a menstrual decrease or a prolongation of their cycle. So we certainly know that on the flip side, COVID can have an impact on your periods. There's a couple of reasons for that. We think it's likely indicative that your body created an immune response. Your immune system and your reproductive system, so the hormones and the chemical signaling between your brain and the uterus, those things are all interconnected. And so it might just be that in your body's effort to produce this robust immune response has this temporary effect. I can't take credit for this, but there's a pretty well-known gynecologist out there, Dr. Jen Gunter. She said, think of the potential menstrual irregularities as a side effect from the vaccine, much like a fever. It's a sign that the immune system's being activated, much like you don't have a fever that lasts forever where you feel hot, that's menopause, but much like your fever doesn't last forever, these menstrual side effects will not last forever either.
Well, this takes us into the next question, which I just had a giggle when it came through. she says, I was fully vaccinated with Moderna right before getting surprise pregnant. I swear it made me fertile. So talking about that, it's been 6 months since my second shot, and I've had the opportunity to get a third shot, but should I wait until the Moderna booster is approved? I'd love to get the antibodies for my baby before. What's your advice? So I think that's whoever wants to answer it. I know the calls I'm on, they are recommending you stay with the dose that you received. So if you're on Moderna, you would not be able to get the Pfizer, but I'm not sure from a medical standpoint if that's actually accurate. Does Dr. Kramer or Bryant, you want to tackle that one?
Yeah, so if you got the Moderna series the first time around, you would want to, based on what we know, and again, we don't know necessarily if this is necessary or not, but it is recommended that you stay with that same brand or the same maker for the third vaccine. Again, I don't think that is not FDA approved yet. I don't think that there's any safety concerns from getting the Moderna versus the Pfizer, and so I would say that it's probably safe to go ahead and get the Moderna as well.
Well, kind of to piggyback on that, while technically the Moderna is not considered or not FDA approved, it is encouraged for people who are immunosuppressed, and you can rationalize that pregnancy is actually a form of immunosuppression, much like women are more prone to COVID, more prone to flu. So by that rationale, you could say yes.
Great. Okay, well, it looks like we have 8 questions in the Q&A. So if you all as panelists are okay with this, I'm just going to read them and then let you all round robin them, or whoever wants to grab it, just grab it. And I'll just start reading them. I've heard on the news that many women are having issues with abnormal menstruation after receiving the vaccine. We may have actually already answered this one. Obviously, it can have an effect on fertility. There have been so many women come forward with this, and there's new research study on it. Do you know any information currently about the effects? So we have answered that one. The anonymous attendee, if you have a further follow-up question, just type it in the Q&A and we'll get to it.
I will say, though, that there is an ongoing study to look at this, because there are more and more people that are mentioning it. And as Dr. Kramer had mentioned, it is temporary from what we have seen and heard, but there are ongoing studies. There's like a large NIH grant to look at this specific topic. So just as everything in this pandemic, more data to follow, we learn more and more each day. So stand by, but as of right now, we presume that it's temporary. I saw someone had mentioned they had no period after the vaccine. So biologically, physiologically, I don't know how that would occur, but certainly it's something that we're interested to find out if that is the case and how we can address it in the future.
Another question that I believe we've answered, but I just want to read it and make sure the panelists feel like we answered it. Fully vaccinated with Pfizer prior to getting pregnant, now is currently 6 months pregnant, and her OBGYN didn't have much to say on the booster. She is also a healthcare worker. Thoughts if she should get the booster now or after she gives birth, which I think we answered, go ahead and get it now.
I would get it now so that your baby has the antibodies that you make cross the placenta to help them as well.
Great. This to me was answered, but I want to go ahead and say it and let the panelists have a chance to say a follow-up comment around it. Since the COVID-19 vaccines are very new, how can we be confident they will not lead to concerns later down the road?
Like I said, I think it kind of goes back to the vaccine material is broken down within days of the vaccine administration. So really the only thing that's left behind are those antibodies that your body has produced so that it can recognize the virus if you're exposed to that and attack the virus ahead of time. So really no studies have shown any type of long-term effects. And so I think the other thing to mention is this vaccine is incredibly well studied. People go back to saying this vaccine is new, but yes, it's new, but the sheer amount of volume and data that we're looking at the vaccine, there is a ton more data on this vaccine than say the progesterone injections that we talk about for prevention of preterm birth now. And so yes, it's new, but it's not that it's not well studied. It's very well studied at this point. The other thing that I kind of plug is that mRNA vaccines are a new type of vaccine, but they're not brand new. The Ebola vaccine was an mRNA vaccine. So these have been used for some time and we haven't seen any long-term effects. So just to provide some further reassurance.
Yeah, that is really great, Dr. Kramer. Really great points.
Yeah.
Um,
And you know, we don't know 10 years down the road. I mean, I 1000% agree with everything you just said. But, you know, when you think about debating, should I get the vaccine or should I not? You know, 20 years down the road, is this vaccine going to cause me to have like a, you know, smaller eye or something like that? I mean, you know, we don't know these very long-term effects, but we do know the very, very real and severe adverse effects of COVID-19. And so, you know, we keep saying that over and over and can't stress it enough. And so, and, you know, getting this vaccine, you certainly wouldn't be a guinea pig. I mean, there are millions and millions of people who've had this vaccine. And so the safety profile is very confident. So.
Great. This is a really great question. Why does pregnancy put someone at a higher risk for hospitalization or death from COVID-19? Great question.
That is a good question. And some of it relates to some of the normal physiologic changes of pregnancy and kind of the stress that it puts on the body. As Dr. Kramer said, pregnancy is also relatively a state of relative immunosuppression. In addition, there's changes as your uterus grows, the baby grows, our diaphragms, the muscle that helps us breathe, actually is pushed up a little bit. So our lung volumes actually go down a little bit, and pregnant women will naturally note a little bit of shortness of breath that is very normal in pregnancy, and a higher respiration rate, higher breathing rate. And because of that, that makes pregnant women have less reserve. So even women with asthma, I always tell them, you have less reserve, meaning you can't go as long having difficulty breathing before you really start having trouble, and your body cannot compensate for that lack of oxygen. So that it's several-fold. That's probably a couple of the reasons why. In addition, your heart is also under a little bit more strain. Again, it's very natural, but it's kind of like being an exercise-induced strain on your heart, you know, while you're pregnant. And certainly that relates to, is different by the stage of pregnancy. Those are just a few of the reasons that it puts you at increased risk. And we don't really know, and, you know, based on all of the maternal-fetal medicine Facebook groups and things like that, we don't really know if delivering babies while mom is very sick helps mom necessarily, but you also reach a point where if mom's on heart and lung bypass, it becomes harder to care for mom. There's certain positioning things we do, certain resuscitation measures and medications that they use for mom that may, that it may work better. Mom may get better faster if, baby is born, which is why the increased risk of preterm birth. It's usually done as a medical decision making to try to help mom. And so I hope that answers your question.
Absolutely. And just our immune systems are so much different when we're pregnant, generally speaking. So,
yeah. And like I said, we know, like with the flu, it also affects pregnant women worse. Any respiratory disease can potentially cause worse infection and worse effects during pregnancy.
The other thing I'll piggyback on, and I hate to be alarmist or fear-mongering, but as Dr. Bryant's talking about us having these decisions of, do we deliver early? This is something that Dr. Bryant and I are doing, honestly, not infrequently right now, because we've just seen such a big increase in the last 2 months of women getting sick from COVID. And so it's a really scary situation. You feel terrible for these patients because they're scared, they're worried about themselves, they're worried about baby. And it's just something that there's some shifts on labor and delivery in August. I felt like I spent more time caring for COVID patients and COVID pregnant women than I did delivering babies, which is just not normal. And so I don't want to scare people, but it has been somewhat of a scary time for us caring for these patients. So all the more reason to consider doing anything you can to protect yourself. Absolutely.
And it's important that you mention that, because it is the reality, Dr. Kramer. So I'm glad you mentioned that. one of the other questions, can I do the Novavax for my third dose?
I'm not really familiar with the Novavax one. I know it's a different type of vaccine that's available outside of the US. I don't know if Dr. Bryant or Dr. Evans has any familiarity.
I am not familiar enough with it to comment.
Yeah.
Since none of us have any familiarity with it, I would say probably not, but yeah, that's a good question now.
Okay, another question about the third dose, which I'm loving this because it's more questions about women that have had obviously their first 2 doses, so that's great. She's scheduled for an induction on Monday and has received both doses of Pfizer. Should she get the third before induction, or if not, or not, since it's so close to birth?
I don't think it really matters. You're not going to get the same, the baby is not going to get the same benefit as if you've gotten the vaccine a couple of months ago. I don't know when you got your first few doses. So I would, if it's available now, I would get it as soon as you can. But it's not necessarily going to make that big of a difference for the baby at this point, because you will likely still have some antibodies in your breast milk as well.
Yeah, it'll definitely help long-term, maybe boost antibodies in breast milk. There's some thought of that, but whether you get it in the next 3 days versus after Monday, I might tend to just personally say after, just because if you're going to have a side effects from the vaccine, do you want to feel crummy? But on the flip side, do you want to feel crummy when you have a newborn? So
I will say though, at least on the infertility side of things, ASRM says recommends to not get it within 3 days of a procedure. So like if I do an egg retrieval on someone and they had the vaccine 3 days ago and they're calling me with a fever that night, is it just from the vaccine, or do they have a pelvic abscess that's forming? Like that's something I don't want to mix up. So at least on the infertility aspect, they recommend not doing it within 3 days of a surgery or a procedure like egg retrieval. So I mean, you guys correct me if I'm wrong, I would think that labor, induction, delivery, you also would not want to have those 2 things complicate each other.
Yeah, good point.
There's no easy answer, but you're not in a bad situation either way, I'd say.
Yeah.
One of the last questions, you mentioned that it can be possible effect on the menstrual cycle by triggering a period due to just the immune response. Do you see the vaccine causing any additional difficulty with ovulation medications such as letrozole or Overdrel? I'm sure I'm butchering those, but Dr. Evans?
You did a pretty good job. It's Overdrel, so that's like an HCG trigger shot. But no, that's a good question, and we haven't seen that. You know, I do hope, as I keep saying over and over, I'm sure that we'll see more and more data eventually. I'm unaware of any current studies that are addressing specifically that, but in regards to the efficacy and how these medications work, we haven't seen any difference at all. So.
Great. And the one last question, the Q&A, and we've talked about, Dr. Kramer talked about you can get the flu shot in one arm and the vaccine in the other. Is that the same, I'm assuming, with the booster shot too? Perfect.
Yeah. That's what our hospital is actually doing. They're putting on clinics where you can go get your flu and your COVID booster all in one time. It's quite efficient.
Yeah.
Oh, I just love this. Thank you so much for spending your evening educating us. This has relieved a lot of my anxiety. We're so glad. This has been just pregnancy and infertility and fertility in general. You know, it's personally my story. I have so much passion around it. So like I said at the beginning, I was just honored to be able to moderate this with these incredible physicians of ours. And if this one person we've relieved anxiety, this was worth it. But I certainly hope the other 50 plus that were on, that we were able to answer all of your questions. We're actually getting one more. Oh, no, not a question. So I appreciate this. Tuning in from Central Illinois. That's so amazing. Thank you for joining us, Michelle. We just are so glad you all came, and we will follow up with an email. I'm going to include the compressed version of this recording so you can refer back to it. And then we'll also include all of our physicians, their information and their clinic numbers if you have an interest in seeing any one of them. So thank you all, Dr. Evans, Dr. Kramer, Dr. Bryant. Thank you so much. And not just for tonight, but for all of your work that you've done this past year and a half and taking care of women during this scary time. Pregnancy is scary time as it is, and having fertility issues and those treatments are scary. And so to be able to have this added on top of it and the way you're caring for our patients, I just appreciate it so much. So thanks so much for all your work. And thank you to all of the participants tonight.